So this is an ozone therapy for the blood, Dr. Smithers?
Yes, yep. So this is basically like a souped up ozone autohemotherapy treatment where we take about 200 mils of blood, we ozonate it, and then run it back through the patient. And we do that 10 times in a row.
Mm-hmm.
And that's where the name 10 Pass came from. So we use a really high concentration of ozone with each pass. And the dosages of the ozone they're getting are much greater than they would get through a direct IV or, just a single autohemotherapy.
Yeah, interesting. So there's other ways to administer ozone into the blood?
Yeah, you can do direct IV. Some of the doctors are doing a direct IV.
What's direct IV?
Direct IV is where you hook up an IV and you run ozone directly into the vessel, just the gas.
Mm-hmm.
And it's relatively safe as long as you go slow. There's a few precautions you have to take when running the direct IV. This is a much safer treatment.
Mm-hmm.
And you can kind of, you can really hone in on the dosages you use with this therapy a lot better.
Yeah. So there's the direct IV, and then there was, you had mentioned autohemotherapy, like for people that aren't familiar with that word.
So the ozone autohemotherapy is the treatment goes back many, many years. It's the same premise. You draw about 200 cc's or mils of blood, and then you ozonate that and put it back into the body. And those were traditionally done with a single pass, one at a time.
Mm-hmm.
And what makes this such a great treatment is that you can run multiple in succession.
Yeah. So the blood goes out of his arm,
Mm-hmm.
and it goes into this apparatus here, and then where does the hyperbaric part come in with the ozone?
The way this machine is set up, the ozone is basically comes from the machine
Mm-hmm.
and is moved into this little, what they call eye set, and it pressurizes this set.
Mm-hmm. So the blood is ozonated with pressure.
Correct. Mm-hmm.
Wow. And that really improves the outcome of the treatment?
Yeah, oh yeah. These are very powerful treatments. Can be used for all types of chronic infections. We're seeing a lot of Lyme patients improve
Mm-hmm.
this treatment. Any chronic viral infections,
Yeah.
all infections really. Ozone is one of the most powerful antimicrobials on the planet. It has
Mhm.
broad spectrum, viral, bacterial, fungal.
So, wow, this is really very impressive. So, that laser is going through a catheter, and it's actually irradiating the blood
That's right. Yeah.
with
So
laser light.
So we're feeding the laser light in the ozone into that set at the moment, and then we'll infuse it back into the patient.
So what exactly is happening here? So the blood's getting ozonated,
Blood's getting ozonated and
and then it's getting irradiated by
irradiated by the laser as well.
the laser. Wow. That is really... I don't know anyone else doing this.
Yeah, I can't imagine anybody else has incorporated the two together.
Yeah, I do know that there are some clinics that offer both separately, but typically doctors that offer this type of laser therapy to the blood is a UV blood irradiator.
Right.
And so they're kind of limited to only about 250 cc's of blood, where this remains in the bloodstream, and it's obviously irradiating a lot more than just 250 cc's.
Right, exactly. We're doing every pass. So
So here's it under the light. You've got the laser irradiating the blood is being ozonated, and then it's going back into the patient. So I'll link to a web page that has all of the benefits of laser to the blood, as well as ozone. So if you wanted to kind of do more research on your own to look at some of the benefits, we'll have links here if you found this video interesting.
For more information about these exciting regenerative therapies, you can find us at advancedrejuvenation.us. You can also contact us by phone at 941-330-8553 or email us at info@advancedrejuvenation.us. If you found the information on this video helpful, please like us and share us on Facebook. You just never know whose life you might touch. Well, thanks for joining us. And remember, if healing is possible, consider it to be within your reach. Bye for now.